What are the risks of a brain biopsy for tumor diagnosis? When considering a brain biopsy for tumor diagnosis, it is essential to understand the associated risks. A brain biopsy, especially a stereotactic needle biopsy, is often a safe and valuable procedure. However, it does come with certain risks that both patients and healthcare providers should carefully weigh. One of the primary risks is intracranial hemorrhage, which is bleeding in the brain. This complication occurs in about 1 to 5.8% of cases, depending on various factors. Bleeding can range from small, asymptomatic hemorrhages to more severe, life-threatening bleeds that can lead to neurological deterioration or even death. Most severe cases happen within the first few hours after the procedure. While fatal outcomes are rare, they can occur, particularly if the tumor is highly vascular or located in critical areas of the brain. Another risk is infection, which is generally low, occurring in less than 1% of cases. This can include wound infections or, in rare instances, brain abscesses. The use of strict sterile techniques and perioperative antibiotics helps minimize this risk significantly. Neurological deficits are also a concern. Damage to surrounding brain tissue during the needle insertion can lead to temporary or permanent impairments. These may include weakness, sensory changes, seizures, or difficulties with speech. The likelihood of these complications varies based on the location of the lesion and the method used for the biopsy, but overall, the risk remains relatively low. There is also the possibility of failure to obtain diagnostic tissue. In about 1% of cases, the biopsy may not yield enough or representative tissue for a proper diagnosis, which may requiring a repeat procedure. Other risks can include issues with wound healing or rare complications related to anesthesia. Despite these risks, a stereotactic brain biopsy is less invasive than an open surgical biopsy. It involves a small opening in the skull and usually requires only a brief hospitalization or outpatient care. Advances in imaging guidance and surgical planning software have improved accuracy and reduced risks to healthy brain tissue. From the perspective of brain cancer and brain health, the benefits of obtaining an accurate tumor diagnosis through biopsy typically outweigh the risks. An accurate diagnosis is crucial for guiding appropriate treatment decisions. However, it is important to consider individual factors such as tumor location and the patient's overall health status. Close monitoring after the biopsy is essential to promptly detect and manage any complications. Patients should engage in thorough discussions about the risks and benefits with their neurosurgeon and multidisciplinary care team. This helps ensure informed decisions tailored to their specific medical condition.